assured that it isn't. Anyway, we've got some of our fabulous panellists, local people. Whoop. In I come, I just wasn't sure how bouncy this was. Joining us is Dr. Shikha Pitalia. Thank you. Also, Philip Sharkey and indeed Phil Eckersley. Hello to you all. Thank you for joining us. Ladies first. Issues for you here in Wigan?
Issues in Wigan very similar to those across the country. We always need more staff, more resources, different ways of working, innovation to try and do the best that we can to provide the best healthcare for our patients.
Okay, you're a teacher?
Yes, I work in I'm a primary school teacher.
Okay, and what are the issues for you?
Currently, with the funding crisis in education, we're really struggling at the moment. We're on a bare bones budget. The children's learning opportunities, they're having to be restricted at the moment just because we don't have the funds that we would have had 5-10 years ago. So we're looking for the manifestos, and we can see the investments for education if it's going to happen. Because seeing it on the shop floor as a class teacher, we've just not got the facilities and the resources that we need to provide the stimulating education that these children deserve.
Yeah, and Phil, you are president of the Wigan president of the Greater Manchester Chamber of Commerce. What do you see as the main issues for the town?
Well, my business is Bridgewater Home Care, and we provide care in the community. So our main focus is recruitment and the skills. And I think that resonates across the whole community, in the business community in Wigan, is that skills is a real issue. Skills investment and people being able to give them the opportunities not to just learn their own roles and their own jobs that they're doing now, but also to reach further education and maybe change industries in a changing kind of business environment.
Doctor, drugs are an issue, aren't they?
Absolutely.
Drug taking, I should say.
Drug taking is an issue, and it's about working.
Hold on a second, was that you? Was that you?
No, okay.
Sorry, Doctor.
So I lead an organisation which is a group of practices, SSP Health. So what we try and do is work in a different way. So allowing doctors to do what they were trained to do, work with patients and deal with priorities that are important for our patients and their families. So we take away all the back office functions, allow the practices to find out what is the best way for individual patients. So, for example, we have a practice just less than a mile away from here in Marsh Green, where the deprivation is one of the worst in Greater Manchester. Drug levels of abuse were very, very high. We have been looking after those patients for just over a year now and managed to reduce the levels of inappropriate drug use by over a third.
That's amazing.
So that's about amazing. Working differently, allowing doctors to focus and taking away the bureaucracy and the paperwork that really doesn't need to be at a doctor's desk.
Amazing. Social mobility, Phil. I went to school in Wigan. Sadly, most of the schools I went to have now been knocked down. I don't know what that says about my education. But what do you think about social mobility for kids in Wigan?
I think there's opportunities there where children, if you're giving the children the environment, they're going to thrive. And it's just for us as teachers to give them those opportunities where they can achieve the best that they can, where they're not restricted just by a facts-based curriculum, where they're given the opportunity to explore and learn and become up with their own learning strategies. And we're missing out on these things. Little things like school trips, we're really restricted on our budget at the moment, and these are lifelong learning opportunities. It's what the children remember, it's what they learn from. And at the moment, we're having to rely on fundraising as a school to find the resources for things like that. We're lucky in the St Andrews family that we are supported by the parents and carers of the children. And we had a recent fundraising event. We raised £1,700 for our school, and that's a fantastic amount of money in our local community. And we rely on that to provide these learning opportunities for the children, which we shouldn't have to. That should be coming from central government.
Some suggestions that Wigan could turn blue at this election. What do you think?
I think it depends what shade of blue. I'm not sure which way it would go.
Right.
I can't imagine Wigan would turn.
When you say that, do you mean Brexit Party?
Yes, indeed, I do. Okay. Yeah, I don't know. It's a very heavily Brexit constituency, and I think in the Wigan.
Why do you think that is? Is it about immigration?
I think there are multiple reasons. I think immigration perhaps is one of those things. I think also people's lives have been affected over the years from feeling disenfranchised with politics. I think there is an issue and an issue with democracy in the country where people feel like the vote doesn't matter. and people want to change, want to feel like the country has more control of its destiny, and all those kind of things. But I think people in Wigan are hardworking, and they really just want to crack on and get on with working, and they want the opportunities. And I think it's up to the Wigan business community and the local authority to encourage businesses to come to Wigan. It's a great place to be, it's a great place to work, and a great place to have a business.
Could it ever be a Conservative constituency, do you think?
Not in this generation, no. I think it's been a Labour hotbed for my father's generation, and that it will. I think we're going to be a Labour stronghold for at least another generation.
Yeah, I mean, I was saying in a report, I'm not sure if you've seen it or not, Doctor, but my grandfather was a coal miner, my father industrial relations lecturer, trade union studies. I couldn't conceive it being a Conservative Party seat, but it's a target seat for them.
I think whoever comes into power in Wigan, as long as they speak to the relevant people, so they speak to health, education and social care, and do what is right and actually focus on the issues rather than making everything a political issue, which is very easy to say, I know, but I think there is huge potential within Wigan. I've been a doctor here for over 30 years, and I think that the people here, the commitment of the professionals is incredible,
yeah.
And I think whoever is in power, there is a huge amount to be done.
And you know what? That body swerve is worthy of the Wigan Warriors front row, is what I would say. It's good to talk to all of you. Thank you very much indeed. Dave, come with me. Thanks a lot. So I'm not quite sure how hard it's going to be. How are you feeling about getting out of this cage, Dave? Give it a go.